Welcome back. Now, many people will be signing up for Medicare plans later in the fall, but this summer marks a big date in Medicare history. It is actually the 20th anniversary of Medicare Advantage. Melanie Heffelman is here from UnitedHealthcare to kind of give us an understanding of Advantage and kind of celebrate the anniversary, right?
Yeah, it's very exciting.
20th anniversary. I think it's just the right time to kind of get everybody up to date. So let's kind of start with what is Medicare Advantage if somebody doesn't know.
Absolutely. So Medicare Advantage is kind of what we call the alphabet soup of Medicare. You hear a lot about Parts A, Parts B, Parts D, and what Medicare Advantage really does is it brings them all together into Part C. So we have Part A and B, which are your hospital and provider care, and Part D is your prescription coverage. When you put A, B, and D together, you get Part C, which is Medicare Advantage.
That was so easy to follow, and I love that we call it alphabet soup.
Everybody likes alphabet soup.
That makes complete sense. So it obviously is working. We're in its 20th anniversary. So because the way I almost understand it, it's almost like an all-in-one kind of a thing. So what kind of an impact has that really had on people?
So Congress actually established Medicare Advantage in 1997, and our ultimate goal was to provide beneficiaries with a choice. So we want to make it simple, we want to make it convenient, put it all together. So with the Medicare Advantage plan, we're going to have additional benefits that aren't covered under traditional Medicare. So we talk about vision, hearing, and dental care. We also have some plans that offer gym memberships, and this is all going to come with a $0 premium on the majority of our plans. So it's a really exciting option to allow our beneficiaries to understand what their benefits include and then establish a predictive cost model that goes with it as well.
Now, everything that you're saying, I feel like my question's already been answered, but I'm still going to ask this because it sounds much more flexible. It covers a lot more. The $0, you know what I mean? Like, there's so many great things, but why do you think it has really grown so much? Because every year I feel like we talk about this, it just is growing in popularity. Maybe it's, you know, people are becoming more educated, but what do you think?
Well, I think that it's becoming more common, and so people are really starting to educate themselves on what Medicare is and what their choices are. So right now we have about 19 million Americans who are covered on a Medicare Advantage plan, and currently Medicare Advantage enrollment is up 50% over the past 5 years. So we have about 1 in 3 beneficiaries choosing it. And kind of like I mentioned before, I think it's the predictable cost that comes with it, the additional benefits, and what's really fantastic is we now have some research that's coming out with the Medicare Advantage plans. So there was a study done by USC in January 2017 of this year, and they found that individuals who had a Medicare Advantage plan actually had better health outcomes when it came to receiving some of the most common surgeries. So they had shorter inpatient stays if they required one. They required fewer days of rehabilitation, and they were less likely to be admitted back into the hospital after they were discharged. So I think that that's really exciting for people to know that when they have the Medicare Advantage plan, that they're going to be covered and taken care of.
And I think just knowing that peace of mind and having this data coming back that really solidifies that, it helps. And you're making this so easy, and I always say here on the show, if I can understand it, anybody can understand it, because you know, things can get very complicated, especially when we're talking about healthcare. A lot of people will understand your mailbox gets inundated with a bunch of information when you know when open enrollment comes. How do we help in making it not so complicated? Again, you've already done a great job already here, but I know there's other ways that we're doing that.
Sure. So if anybody has questions specific to UnitedHealthcare plans, they can visit uhcmedicareplans.com. They can call us. We have representatives available most days of the week, and they can reach us at 1-800-UHC-6509. But if they're wanting to learn more about just general Medicare, they can visit medicare.gov, and there's a lot of information out there, and I really encourage people to be their own advocate. Ask the questions. If something doesn't sound right, question it. Ask your neighbors, hey, what are you guys doing? Maybe talk to your providers about it if you have a good relationship and say, what do you recommend? And use that information to your benefit.
And I know we've said this also before, is always look to see what is coming out, what's new. Can something possibly be better for you? Don't always just think, oh, whatever I had last year, let's, you know, roll it over. Always be educated and get into that. And we're talking about this right now because of this great 20th anniversary,
Yep.
but we were talking about enrollment. When is that enrollment time?
So there's a couple different windows that people have when it comes to Medicare enrollment. So if you're new to Medicare, there's a 7-month window around your 65th birthday to which you can enroll in a plan. Okay. So you have the 3 months prior to your 65th birthday, the month of your birthday, and then the 3 months post your birthday. If you are already covered on a Medicare plan, then we have what we call open enrollment period, and that runs from October 15th through December 7th each year, and that gives you an opportunity to make changes to your plan, maybe shop for a new one, ask those questions, or maybe switch your package around a little bit.
So there's lots of opportunity. I think that 65 is the one that we need to really hit, because I feel like everybody hears the open enrollment. They say it on TV. We'll talk about it once it gets here. But that 65 is something that everybody should remember. You don't have to wait for the open enrollment once your birthday gets here.
Right, absolutely. So if you have a March birthday or maybe August, it may not necessarily be open enrollment that you target. But again, you know, do your research, check online. Check out the Medicare.gov, give us a call. We're happy to help any way that we can.
Absolutely, because it's never too early to get educated. That part you can start doing now. Yes. Don't wait until open enrollment. Get your ducks in a row now. So I'm going to remind them again where they can go to get that information. But thank you so much for coming here. We're going to talk about that 20th anniversary, and a lot of people learned about this.
Thank you
so much. Now, if you want to learn even more about UnitedHealthcare plans, visit uhcmedicareplans.com, or you can call 1-800-UHC 6509.